Hi, my name is Caitlin Sweeney, and I am a physical therapist and certified lymphedema therapist with specialty training in oncology rehabilitation. In honor of Breast Cancer Awareness Month, I'm here to talk to you about lymphedema, which is something that can develop in association with breast cancer treatment. Lymphedema in the breast cancer population is most noticeable by swelling in the arm or breast region. More specifically, the swelling is an abnormal accumulation of protein-rich fluid in the interstitium of the body, which may cause chronic inflammation and reactive fibrosis of the affected tissues. Other signs and symptoms of lymphedema include a feeling of heaviness or achiness in the affected arm or breast region. Onset can be slow and gradual or can be more of a sudden onset. Without treatment, lymphedema is typically progressive in that patients will experience further increase in swelling and heaviness with skin changes such as hardening and or breakdown of the skin in later stages of lymphedema. In some patients, this develops in response to either removal of or damage to a portion of the lymphatic system, which is sometimes a necessary component of breast cancer treatment, whether due to surgery or radiation therapy. I want to mention that not all breast cancer patients who have had surgery or radiation therapy will develop lymphedema. It can be difficult to determine which patients will develop lymphedema, but research points to a higher incidence of lymphedema developing in a patient who has a significant number of lymph nodes and or vessels surgically removed with an axillary lymph node dissection, as opposed to patients who have only 1 to 2 or maybe 3 lymph nodes removed surgically during a sentinel lymph node biopsy. Research also suggests that patients are more likely to develop lymphedema when they have had radiation therapy in addition to surgical intervention to treatment of their breast cancer. With that being said, I've had many patients who have had many lymph nodes removed and have undergone radiation treatment who have never developed lymphedema. But on the other hand, I've also had patients who have had very minimal disruption to their lymphatic system during surgery, meaning they've only had maybe 1 or 2 lymph nodes removed. They did not have radiation treatment, but yet still developed lymphedema postoperatively. So it can be difficult to predict. That's why it's so important to be aware of the risk and know how to identify the signs and symptoms so that you can get early treatment for lymphedema and minimize its impact on you long term. Next, we're going to talk about treatment of lymphedema. Stay tuned.